Before looking at the lungs, it's important to understand the structures that contain them. The thorax, the two pleural cavities that lie within it, and the structures that produce respiratory movement are shown in tape 3 of this atlas. Seen from in front, the lungs are here. Seen from behind, they're here. Seen from either side, the lung is here. A large part of each lung lies behind the heart. The lung extends from the ribs in front to the ribs behind, and from the dome of the pleural cavity down to the diaphragm. With each breath in and each breath out, there's an increase and a decrease in the volume of the lungs. Here are the lungs by themselves, seen from in front. They're being inflated with air so as to maintain their shape. Here's the trachea. Here are the two principal bronchi. This is the apex of each lung. This is the base. The space between the two lungs is occupied by the heart and great blood vessels. Each lung has 3 surfaces. The medial or mediastinal surface is marked by the hilum, where the bronchi and blood vessels enter. The concave inferior surface rests on the diaphragm, and the large convex costal surface faces the rib cage. Each lung is divided by deep fissures into lobes. The right lung has a superior lobe, a middle lobe, and an inferior lobe. The left lung has only a superior and an inferior lobe. Here are the lungs seen from behind. The fissures that separate the lobes extend all the way round onto the mediastinal surfaces. The space between the posterior parts of the lungs is occupied by the vertebral bodies. To see the lungs in a more intact setting, we'll look at a dissection in which the anterior chest wall has been removed. Again, the lungs are being inflated with air to keep them expanded. The surface of these lungs is discolored by trapped carbon particles that come from a lifetime's exposure to smoke. The two lungs are separated by the mediastinum, the midline partition that's occupied largely by the heart and great vessels, and also by fat and lymph nodes, and in childhood by the thymus gland. The surface of the lung is formed by the visceral pleura. The visceral pleura covers the lung completely, except here at the hilum, where it becomes continuous with the parietal pleura. Taking a close look at the edge of the lung, we can see the alveoli, the tiny air spaces where gas exchange occurs. They're opening progressively as we slowly inflate the lung. Here, we're letting the lung collapse so that we can see the two separate pleural surfaces, parietal and visceral. The two surfaces are normally in close sliding contact with nothing between them except a film of serous fluid. When we have the thorax laid wide open like this, it's hard to appreciate the seal that normally exists between the two pleural surfaces. To see that, we'll go to a more intact dissection. To expose the parietal pleura, we'll remove the intercostal muscles from these intercostal spaces. The parietal pleura that lines the chest wall is attached to the inner aspect of the ribs. The visceral pleura, covering the lung, slides just beneath it. When we puncture the parietal pleura, we break the seal between it and the underlying lung. The lung, no longer pulled outward, slowly collapses as air enters the pleural cavity. Here in an open dissection, we're producing the same event, collapse of the lungs, by ceasing to inflate them. The function of the lungs as organs of gas exchange depends on our ability to breathe in and out. In this, the lungs themselves are passive. Their shape and volume conform from moment to moment to the shape and volume of the cavity they're in. When the diaphragm contracts and moves down, and when the intercostal muscles move the front of the ribcage upward and forward, then the volume of the thorax increases, the lungs expand, and air is drawn into the lungs. When these movements are reversed, the lungs are squeezed into a smaller space, and air is blown out. Now we look at the pulmonary vessels and the trachea. To do that, we'll take the heart out of the picture and draw the lungs out to the side. This gives us a view of the medial surfaces of the lungs. There's a lot to see here. We'll look at blood vessels first. This is the aorta, heavily calcified in this specimen. It's been divided just at the beginning of its arch. Here's the divided right pulmonary artery entering the hilum of the right lung. Here's the left pulmonary artery. A little below the pulmonary arteries on each side are the pulmonary veins. Here on the right, here on the left. Above and behind all the great vessels is the lower end of the trachea, or windpipe. It passes downward into the thorax, just to the right of the aortic arch. Here are the same structures in a different specimen. Here, we've left the lower part of the pericardial sac intact. Here are the divided ends of the pulmonary arteries and pulmonary veins. Remembering what we've seen of the heart, it's not hard to envision the pulmonary trunk and its bifurcation here, and the left atrium, if we were to stretch it out, here. If we take the aortic arch out of the picture, we can see the trachea coming down through the superior thoracic aperture, behind the upper part of the sternum. Here's the trachea by itself. Its upper end is continuous with the cricoid cartilage. It ends here, where it divides into the two main or principal bronchi. The principal bronchi begin to branch as they enter the lung, first into lobar, then segmental branches. The corrugated appearance of the trachea comes from the series of C-shaped cartilages that strengthen its wall and keep it open. In between them, the tracheal wall is soft, so that the trachea is highly flexible. Here, we've divided the trachea close to its bifurcation. The cartilages end here, making the trachea somewhat D-shaped in cross-section, with a posterior wall that's quite soft. Before ending this section, we'll briefly look at the esophagus. Here, in a dissection where we've removed all the pericardial sac, we can see the lower end of the esophagus. The esophagus passes behind everything else in the mediastinum to reach the esophageal hiatus in the diaphragm, through which it passes to enter the stomach. Now, let's review what we've seen of the lungs. Here are the lungs. On the right side, here's the superior lobe, the middle lobe, and the inferior lobe. And on the left, the superior lobe and inferior lobe. Here's the parietal pleura and the visceral pleura. Here's the hilum of the lung, with the trachea, the principal bronchi, the pulmonary arteries, and the pulmonary veins. Lastly, here's the esophagus.